Good morning, I'm Matteo Di Gioia from the Di Gioia Martinetti Orthodontic Studio. Today we'll look at a case of a little girl with a class 2 malocclusion, meaning her teeth don't come together properly, with a canine, as you can already see here, that's very high and growing on the gum, because underneath there is no space for it to come out. This is the initial state of her smile. As you can see, there's the mouth. All the teeth are shifted to the left, where on the left side the high position tooth is present. And with this tooth, there's no space at all. One of the reasons is that the front teeth have all tilted to the left, taking up the space needed for the canine to erupt. Look at the degree of inclination. And from there, we brought her to this result. Look at what an incredible change. These are the kinds of changes that truly transform our patients' lives. We achieved all of this without extractions, without using mini screws or anything unusual, without surgery, simply with clear aligners and elastics. So the initial situation had the center of the mouth shifted entirely to the left compared to the face. A slight asymmetry of the chin, but who doesn't have that? And in terms of profile, a good profile, meaning the lower part, the chin and the area below the nose are practically at the same level. This is the initial situation, where you can see a deviation of the midlines, that is, the upper one. We said it is shifted all to the patient's left. You see everything is shifted to the patient's left. While we are looking at the screen, of course, it's on the right, but for the patient, it's on the left. So the lower part is the correct one. At the top left, there's a canine that is completely out since it doesn't have any space. There's no space for it to come out. And also on the right side, there isn't much space either. But there's a little more space there. This canine doesn't know where to come out, so it has come out a bit, but not completely. If we look at the mouth, the palate, the upper dental arch as seen from below, you can see how on the patient's left side, this canine should fit between these two teeth, but there isn't any space. Usually, in these cases, a tooth extraction is performed, but extracting this tooth would have been a mistake for the aesthetics of the face because we wouldn't have been able to realign the upper midline. On the right, on this side as well, the canine doesn't fit, so it comes out completely to the outside, what we call vestibular. It sticks out entirely. If we look at how the teeth fit together, you can see that the one marked in green is correct, while our tooth is at the level of the red line. We say that this patient has a class 2 bite, meaning the upper teeth are ahead. They're ahead by a whole tooth compared to the lower tooth, which is the worst possible situation. There's nothing worse than this. The bite couldn't be more wrong, with the back teeth coming forward like this. In other words, this red should be where the green is. But instead, everything being forward causes these teeth, by moving forward, to take up space. They steal space from the canine, which can no longer come out, not on the left, and even on the right, it's not positioned well either. A really difficult situation to correct, which, as we've said, usually can be fixed either with extractions or surgery. But we managed to do everything without these interventions. On the bottom, the issue is simpler. The teeth are just a bit misaligned. So we simply need to realign them. Let's take another look. The upper teeth are all ahead of the lower teeth. So what we do is make these teeth move around a bit. You can see that the upper teeth need to move back until space opens up. To allow this high buccal canine to come down on the left and also on the right. The teeth move back until there's enough space for the canine to come in. You can see that we need to shift the entire center. The upper jaw needs to be moved toward the patient's right to recenter it with her face. This is the treatment simulation to be done with clear aligners, and we use it too. Thank you. Creating space for these teeth also involves the use of elastics, which are attached to buttons bonded to the teeth. These can also be white, or to attachments, which are small drops of clear resin. Here they're shown in red, but in the mouth they're actually transparent, as are the clear aligners, which, when worn, appear. They are visible as these transparent trays with the attachments. This is the famous button. You can see that during the treatment the teeth become aligned. But this canine is so far out that it even sticks out beyond the aligners we had planned. For him, this is the progression of the case in the upper arch, so the initial situation was completely no space for the canine, thank you. Then, little by little, we start to push these teeth back, changing the aligners, and you can see that spaces begin to open up precisely because the teeth are moving further and further back. You can see they keep moving further back, the space keeps opening up more and more, it opens up even more, and now we're almost there. And in the end, this canine finally manages to find its space among all the others. So this is a huge orthodontic achievement, something incredible. And so we achieve immense changes in the smile, even for the patient, which is what matters to her. That is, from this situation with the midlines that are off-center. The canine is high on both the right and the left. Let's move on to... Look at how wonderful this situation is. Here, straight teeth, the midlines are practically aligned, and the canine has been put back in its place. Look at this here. We haven't just changed the aesthetics, which is certainly very important, but also the bite by restoring the guidance of this canine to where it should be, that is, behind the lower canine. Those teeth, you see, fit together perfectly, 1 against 2, just as nature intended. Nature would want it this way on the left, without extractions, without surgery, and the same on the right. You see, we start with 1 tooth against another, 1 tooth against another, and we end up achieving a perfect closure of 1 tooth against 2. This is truly a beautiful result, beautiful. And so again, the upper arch, no space for this canine to come out, no space for this canine to come out, and then almost always a bit of magic. But in reality, it's the treatment with clear aligners, carried out, I would say, this time truly effectively. We managed to achieve everything we want, and of course in the lower arch as well, we align the teeth properly. The final result is all the teeth straight in the mouth. And this is the beginning. And this is the end of the treatment, and this patient says that indeed, not extracting this canine, which was very high up, some would have even considered extracting it, was the best choice of her life for her smile, for her life. And this is what can be achieved in patients with a class 2 malocclusion, a proper closure with aligners, elastics, and attachments. So thank you very much for your attention. And if you also have a similar situation, in short, consult with your trusted orthodontist, because it is possible to achieve these excellent results. Thank you very much. And a great smile to everyone.